The Journal of the American Medical Association published the first long-term study showing that treating high blood pressure with thiazides, that class of drugs, can actually prolong life. So we're going to talk about how long it can prolong life and if it's worth it.
Yeah. Well, I think we've known for a long time that treating hypertension is worth it. We don't have the long-term data until recently that shows that, yes, you can really extend life, and the question is how much. And for every month that we treated people with a diuretic, the thiazide diuretic, we got 1 extra day of life. So over a period of 10 years, it amounts to about 4 months. That's worth it. And yet you look at the side effects now that you get of the thiazide diuretics, and you're looking at it raises your cholesterol level, it makes your insulin sensitivity worse, so you're prone to getting type 2 diabetes. It raises uric acid, so it puts you at risk for gout. It lowers your potassium and your magnesium levels. So there are problems that can come with it, and quality of life issues become something to consider.
So you might live a little bit longer, but maybe the quality of your life is going to suck.
Well, I wouldn't be that aggressive about it, because what you're looking at is the negative aspects of thiazide diuretics on one side, and the negative aspects of what happens if you don't treat hypertension, which is what? A heart attack or a stroke.
But there are other ways to treat hypertension with lifestyle.
Indeed, and those studies haven't been done, of course.
Of course, because those don't make pharmaceutical companies money.
Right.
But we know that exercise reduces blood pressure.
We know a lot of things that will do that. I still I don't want to get off track here and say that I don't think we should treat hypertension. I do think we should, and you're right, lifestyle is the best. But if you can't get people to do what you want them to do, and they won't do the exercise or eat right or reduce their stress or sleep right, now you're looking at something that is definitely beneficial, and it extends life. I mean, I wouldn't want to go through life with a heart attack or a stroke. I'd rather take the risk of getting a little problem with cholesterol or a little diabetes or a little bit of gout. But thank you, I don't want that heart attack and stroke.
Right.
So we know that we're on the right track in medicine from the point of view of knowing that we need to treat it. Where we've gone off track is we focus so much, like you're saying, that we look to the drugs and we forget about there are a lot of things we can do. And you're so right about exercise.
Well, maybe another thing, too, here is that we should define what hypertension is, because many times if a blood pressure is taken incorrectly, you can be treated with a medication when maybe you don't need it, because it's normal for our blood pressure to fluctuate. It's also normal for it to be different in each arm.
A little bit.
The size of the cuff makes a difference, whether your position, if you're sitting or lying or what have you, and
right. So the technology is important, and actually most doctors don't do it right. You should take it. In fact, I don't a lot of the time either, I have to admit, because you should be taking blood pressure simultaneously in both arms and seeing if there's much of a difference. If it's more than 10 millimeters of mercury, that's a predictor that you're going to have problems later in life with that. We tend to get into the habit of just following the height of the blood pressure, and anything that's over 140/90 was just arbitrarily picked to be abnormal. But it's interesting that as we look at mortality, and we look at mortality, and we look also at the incidence of heart attacks and strokes, as your blood pressure gets closer to 120/80, your prognosis is better.
The other thing is, too, is many people have a high blood pressure when they go to the doctor because they're a little nervous about it. That's called white coat hypertension.
Well, let's say you're waiting for the doctor and he's not on time, so you're starting to get a little irritated. Then they put you in the room and it's a little bit cold, and they put you in a gown, and now you're waiting again. And by the time the doctor comes in, you're frosted, all right? And your blood pressure, if you're a normal person, is going to go up a little bit because that's a normal adrenaline response. Some of the time it goes up a lot, and the doctor gets alarmed, and then the next thing you know is you're taking blood pressure pills for the rest of your life.
And sometimes you don't need them.
Right. Plus, what about the lifestyle things that we can do? I mean, we know that if you exercise hard and you sweat, that your blood pressure is going to drop substantially for a few hours. And if you do that a couple of times a day, I mean, it not only suppresses your appetite a little bit so that you'll eat less, but it'll lower your blood pressure.
Well, there's other things you can do, too, like yoga and qigong.
Absolutely. And learning how to breathe right. There's an awful lot that is reflected in the breath and how we breathe that can be corrected by breathing exercises that are really kind of fascinating, that can give us a much bigger drop in blood pressure than you'd think. There is this thing called RespiRate that a lot of people are using now. I put a lot of my patients on that teaches you how to breathe in a way It stimulates the parasympathetic nervous system, which lowers blood pressure, rather than breathing through the chest more, which is more sympathetic and tends to raise blood pressure because it stimulates the fight or flight response. So I think that this is a kind of a landmark study that tells us what we already knew, that people are going to do better if their blood pressure is normal. The place where it's gone awry is when we start looking at using drugs to do that, but I will agree that it's better to use the drugs than it is not to and run the risk of having a heart attack, a stroke, or one day a month shorter lifespan.
And the safest thing is a healthy lifestyle. So you want to eat right and exercise, get enough sleep, reduce your stress, have a meaningful purpose in life.
Right.
Listen to some relaxing music.
Chances are your blood pressure will come down and you won't have to use these drugs.